What's up, Warriors? Welcome back to another episode of the Suburban Warrior podcast. I'm your host, Chrissy Pfeiffer, and let me just say happy December. Happy last month of 2025 as we wind down here on season 6. For all of December, we will be running the best of season 6 episodes. So if you missed it once, well, guess what? You get to listen to all the best episodes of season 6 right here in the month of December. And we'll be back next January, yes, in 2026, with a whole new season of Suburban Warrior, season 7, starting first thing in January. So thank you so much for being here. Thank you for being such a supportive listener of the Suburban Warrior podcast. We've had such an amazing year, and I'm so grateful. Record number of listening to the podcast, and that just means that we are helping to empower and educate more and more women each and every week. So on that note, be sure to visit suburbanwarriorpodcast.com to download your free From Pause to Power roadmap. This is everything you need to know for your perimenopause and menopause journey. That is a free download for you. It's everything I wish I knew 10 years ago when I started this journey, right there for you for free. And while you're there at suburbanwarriorpodcast.com, don't forget to sign up for our free weekly newsletter. Basically, this is the top points of each week's podcast delivered right into your inbox. So once again, thank you so much for being a part of the Suburban Warrior podcast. Thank you for being here on this journey. And we'll be back next year with another amazing season of Suburban Warrior, here to empower, educate, and attack midlife wellness with grit and grace.
And I think it's going to be really interesting to see how people in their 30s who are partaking in these injections look when they're 50 or 55. I always tell my patients, everyone's always worried that they're going to look frozen or unlike themselves. And that's not the goal at all. The goal is not to turn the music off, but just to turn the volume down.
Welcome to the Suburban Warrior podcast, the podcast that inspires, educates, and empowers women navigating the chaos of midlife, perimenopause, and menopause. I am your host, Chrissy Pfeiffer, a holistic health coach and fierce advocate for women's wellness. With a background in nursing, the pharmaceutical industry, and integrative nutrition, I blend medical expertise with a holistic approach to help women heal naturally, integrate science-backed therapies, and take control of their health. After enduring my own 10-year battle with perimenopause symptoms, I've made it my mission to ensure that no woman has to suffer in silence. Join me as I share expert insights, real-life stories, and actionable strategies to help women reclaim their vitality, prioritize their well-being, and redefine midlife wellness with grit and grace. What's up, Warriors? Welcome back to another episode of the Suburban Warrior podcast. I'm your host, Chrissy Pfeiffer, and I'm back this week with another amazing and beautiful Suburban Warrior here to share her story with us. And I'm really excited because today we are going to talk about all things beauty. And I know that, for us, a lot of women in midlife, we're really doing everything that we can to feel refreshed, feel good, look age appropriate. But also, there's a lot of things that we don't know. Like when we talk about plastic surgery, it can be a little scary for some people. When we talk about facelifts, I think a lot of people think back to like the days of where, you get a facelift and you may not even look like yourself anymore. But times have changed. Those days are gone. And there are so many more options for us now that we just don't know about. And that's where today's podcast is really going to educate and inform us. And we're going to hear from the best. So I would like to introduce my guest today. She is a facial plastic surgeon with extensive experience focused on the delicate anatomy of the head, face, and neck. Dr. Bayrak specializes in advanced surgical and non-surgical techniques dedicated to optimizing the facial aesthetics. She values her abilities to personally connect with patients and to provide individualized treatments that yield natural results. Coupled with her dedication to detail and precision in the operating room, her commitment to patient education and comfort in the clinic distinguish her from other surgeons. Dr. Bayrak combines her extensive training in both head and neck surgery and facial plastic and reconstructive surgery with her innate eye for aesthetics to create refined, refreshed, and rejuvenated outcomes for her patients that are long lasting. Her goal is not for her patients to look unlike themselves, but rather to always look like the best version of themselves. Dr. Bayrak is in private practice at Bayrak Plastic Surgery in Westchester, Pennsylvania. Welcome to the podcast, Doctor. It's so wonderful to have you.
Hi, Chrissy. Thank you so much for having me. I am so excited. I love talking about this stuff. And I especially love it because so many of my patients are women. So to feel like I can help them try to figure out what's best for them in an otherwise very anxiety provoking field is the best feeling in the world. And I love doing it. I love having that role in people's lives.
Well, I love that you're here willing to share all this great information with us, and I'm excited to hear what you have to say. So, I would love to hear first and foremost a little bit about you and sort of like how you even got into this field of plastic surgery.
Yeah, definitely. I wish I had a story where it was like there was just like one finite moment where I woke up and I was like, I'm gonna be a doctor. I don't have that. I remember being a child and I wanted to be a ballerina. And then all of a sudden I just knew. I grew up wanting to be a doctor. And so I went to college, went to medical school. That was always the goal. I never even entertained another option. And in medical school, you do what are called rotations. And so you spend a specific amount of time doing various specialties so that you can try to figure out what you want to do. And I immediately knew I wanted to be in the operating room. It is just a different place. And anyone who, I guess, has been to medical school can tell you that people either love it or they hate it. And I just loved the adrenaline. I loved physically taking care of people. It just appealed to me a little bit more than anything else that I rotated through. And so the first decision I made was I'm going to be a surgeon. And then the second decision I made was, okay, what, like, there are a million different types of surgeons. What do I want to do? And I have always been attracted to beautiful things. And I don't know if there's a term for that. I do know that, my mom tells stories of going to stores with me when I was younger, and I would automatically gravitate towards the most beautiful and usually expensive thing. So I think I'm just drawn to that. And I think there's something very elegant about the face and about facial procedures. So, when you're on your surgery rotation, I mean, you go through everything: general surgery, trauma surgery, urology, orthopedics. And when it comes to the face and when it comes to head and neck surgery, even the instruments are so different. They're so fine, they're so delicate because the face is delicate. And so
Right.
I loved that aspect of it. It just felt a little more elevated to me. And I also kind of sadistically liked the fact that your face is high risk real estate. And so, there are actually some interesting statistics out there on, what percentage of people are willing to undergo body surgery, whether that's a mommy makeover or breast implants, versus the percentage of people that are willing to undergo face surgery. And there's a metric that surgeons use to determine, okay, if I see 100 consults, how many of those consults are going to end up booking surgery? It's called your consult to surgery conversion ratio. And what we know is on a national average, meaning it doesn't matter who you are, the consult to surgery conversion ratio for body surgery is about 60 to 70%. For face surgery, it's about 25 to 35%. So
Wow.
people are so much less likely to have facial procedures because of the nature of the area. So I tell my patients, this is your beach block. This is your high
Yeah.
risk, high value real estate. And so I kind of like, I guess I like the thrill of it, honestly. And I also think that it's such an integral component of an individual's identity. I think as people, we to distill it down, I think we have two things. I think we have our face and we have our name. And
Yeah.
both of those things are usually very important to people. So I just basically made the decision that I wanted to do not just plastic surgery. I actually skipped that part. I knew I wanted to do facial plastic surgery. And so I chose and was fortunate enough to be accepted to a head and neck surgery program, typically pretty competitive. And I did 5 years of head and neck surgery and really feel like that's what creates an expert and kind of from the top of the head to the clavicle. And then I did my fellowship in facial plastic surgery. At the time, I did not just the cosmetic procedures, but I actually did a lot of facial trauma. So, car accidents, bar fights, scooter accidents, you name it, I did
Yeah.
it. And a lot of cancer reconstruction as well. And, those kind of aspects of facial plastic surgery had their own advantages, but I always liked the cosmetic procedures the best. And there's something to be said for, you know, being able to operate and take care of, healthy patients and not people who are usually having the worst day of their life.
Right.
So
Right.
that's how I got into the world of cosmetic facial plastic surgery.
I love it. That's amazing story. And as I was a nurse and I was an OR nurse and I went right into the OR from college because I was lucky enough to be able to do a perioperative rotation. And I was like, this is all I want to do. So I was also one of those people that absolutely love the OR and love surgery. So I totally get that aspect of it. Okay, so let's get into all the things that we could be doing or options that we have as women in midlife because there are a lot of options for us, right? There's injectables, there's lasers, there's procedures, there's surgeries. So I'd love to start sort of with what I think might be the least invasive that people might be doing, which is injectables, the Botoxes, the fillers, Dysport, Botox, the fillers. What
Mhm.
is your take on those type of injectables?
Totally. So I find that the best, most natural, most refreshed results I get are typically in patients who do a combination of everything. We
Okay.
don't want to lean too heavily into one category. So with injectables, I am actually a pretty big proponent, and I say that as a surgeon. Now, injectables, I typically group into two categories. The first category are your neuromodulator medications, and these are medications like Dysport, Botox, Juvo, Xeomin, Daxxify. Those are the brands that are currently available to the consumer. And these medications work by essentially paralyzing or weakening muscles. So we think of wrinkles as a skin problem, and they kind of are, but pretty indirectly. It's actually the muscle underneath that's creasing the skin. And I always say the skin's like a napkin. If you fold it the same way over and over again,
Yeah.
when you unfold the napkin, you're going to see those lines. So when it comes to neuromodulator injections, I'm a huge fan. And I think it's going to be really interesting to see how people in their 30s who are partaking in these injections look when they're 50 or 55, because I
Yeah.
would argue that they will never have a wrinkle that's etched into their skin. And I always tell my patients, everyone's always worried that they're going to look frozen or unlike themselves. And that's not the goal at all. The goal is not to turn the music off, but just to turn the volume down.
Yeah.
And so I do think I just, in all aspects, appeal to a crowd that just wants a more natural look. And I really can't think of a single patient that really likes to be stone cold frozen because that's not how people want to look. And yet that's what we associate with these treatments. So part of my job is dispelling myths. So when it comes to neuromodulator injections, these last for about 3 to 4 months in the average patient. And I find that you're better off doing a little bit on a regular routine basis than just doing it once or twice a year and really kind of, you know, heavy on the gas. So
Yeah.
I'm a huge fan. in terms of fillers, I think they've been demonized a little bit.
Yeah.
And I totally understand why. Because we we as a medical community did kind of get a little overzealous with them. And I will say, I don't think it was entirely our fault because when fillers first became FDA approved for cosmetic use in the early 2000s, we kind of only knew what the companies told us. And maybe with your background in pharma, Chrissy, you can
Yeah.
attest to this. But, someone would come to your office, they'd say, oh, this is Juvederm, this is Restylane, this one lasts a year, this one lasts 18 months. And you'd say, okay. So we started using these products. And I think the biggest mistake we made unknowingly is that we used them the same way we used the neuromodulator injections, meaning we tried to do them on a schedule. So let's say you come in and it's been a year since I did your lips. The tendency back then would be, okay, it's been a year, it's time to do a little bit more, regardless of what your lips looked like at the time.
Right.
So now I definitely push more towards filler is something that we watch because the rate of metabolism is very variable from person to person.
Okay.
I do a fair bit. I have some patients, to keep going with the lips example, I have some patients that I did their lips 2 or 3 years ago. And if they still look good, we don't touch them, regardless of what the box said.
Right.
On the other side of the same coin, really, I have patients that they don't get as long. They get maybe 6 to 9 months. But the point being is, this is something that we watch because unlike the early 2000s, what we have now are we actually have MRI studies that show that filler lasts or can last a lot longer than we thought it did.
Right.
And basically, what these studies show is that when you go into an MRI machine, or when you have images from an MRI scan, you can actually see someone's filler. So I always joke and say, if your radiology tech is asking you if you got your lips done, don't even lie. Just fess up to it because they're
Because
looking at
they
the
know.
screen back there. They
Right. Right.
know. So I think we've learned a lot. We've come a long way, but that's what happens with any new product or treatment or device.
Of
There's
course.
always a period where we're really trying to finesse our treatments and kind of see what happens in the real world. So a little bit of filler can be very beautiful and it can help maintain and sustain even surgical results. So I like to say nothing is all good and nothing is all bad. It's
Yeah.
all about how much you do it. And there's an old quote, the dose determines the poison.
Yeah.
So, we think of water as a good thing, right? We want to
Right.
drink as much water as we can. But I remember when I was an intern, one of the first patients I was responsible for in the medical ICU was a runner who drank too much water and completely destroyed their electrolyte balance. And they were in the
Wow.
ICU, young and healthy. So, everything is fine in appropriate quantities. And
Right.
I think the biggest thing there is to go to somebody you trust, go to somebody that's not just telling you yes every time you ask for something.
Yeah. Yeah, absolutely. So let's talk a little bit about that filler, and because I do agree that it has been demonized a little bit in maybe the last like year or two. And I think I don't know, the myth or, that it stays there forever. So is it really staying there forever, or is it just taking longer to metabolize than what was initially thought?
I'm of the mindset that it's just, in some people, it takes longer to metabolize than we initially thought. And I also think that in people who are routinely getting filler before they need filler,
Right.
there is a layering effect that's happening. So your body can never like completely clear what's in there because you're constantly adding more.
Right.
Now, the other thing that's important to realize is that most fillers nowadays are hyaluronic acid. And that's a
Yes.
term that most people are familiar with because it's in a lot of skincare products now.
Exactly. Yeah.
So, hyaluronic acid is actually a naturally occurring compound. So, our bodies make it. So, we have it, we produce this. And so, every now and then, I'll get someone that's very wary about putting something unnatural into their body, rightfully so. And I always say, listen, like hyaluronic acid is already in there. We have just harnessed the ability to make it in a laboratory. So I think in kind of a real world situation, it's more so the fact that we are not allowing people's bodies to metabolize what we put in before we add more, or it was overdone from the beginning.
Yeah. Okay. Okay. So fillers, injectables, people are maybe that's where they start. They want to go to the next level. What's
Mhm.
next? What's the next step in, feeling looking natural but looking refreshed, anti-aging sort of. What would you go to? What are some next level things for you?
Yeah. This is actually a pretty significant demographic of my practice. I call them kind of the in-betweeners, where eventually, most of my patients are female. I would say about 70 to 80%. And eventually we get to a point and really an age where your neuromodulator, your Dysport or your Botox, we're maxed out on what that can achieve. We're maxed out on what fillers can achieve. At that point, we then have to make a decision. Am I okay doing what I've been doing and accepting of the fact that I'm going to continue to age and I'm not going to get as much out of my neuromodulator and filler treatments as I used to? Or am I willing to take it to the next level? And that's a very personal decision that people have to make because
Yeah.
surgery is not for everyone. And because ultimately that's what the next step is. A lot of my patients are perimenopausal or menopausal, and there are very real changes that
Yeah.
happen specifically to women during those ages. Women and men age completely differently. You don't need a facial plastic surgeon to tell you that. I
Right.
see husband and wives come in together all the time actually, and it's just very different the things that happen in a female face. And so most women are bothered by the downward descent of their soft tissue. So I hear things like my face is falling off, my face is melting, sagging is a big word that we use. And the other part of the puzzle is that we lose volume in our face. So not
Yeah.
only do we have a downward descent of volume, but we actually have less volume than we used to because a lot of the fat in the face has estrogen receptors on it. And so as our estrogen supply decreases, the fat is similarly affected. The only thing that's really going to lift is surgery
Yeah.
at that point. And we can talk about things that are marketed to lift, and I can tell you my experiences with them.
Yeah,
But
I'd like to know.
ultimately, yeah, yeah,
Because I think, listen, especially in the last couple years, let's be honest, everybody's selling to perimenopause and menopausal women because more and more people are talking about this period of our lives and it's wonderful. I think it's great that we're talking about it. But I also think that we've become a very targeted market for things that work wonderful and things that don't. And so I would love to know what you know about what's out there, what are they saying, and what is really worth the money or worth using, because some of it I think is a bunch of just marketing. And having been in marketing
totally.
myself, I
Hmm.
know.
Totally. I mean, and you can't really blame them. Like
No, of
there's a
course not.
demand for something, so they're going to
Yeah,
try to meet that demand. But
absolutely.
ultimately, my job is to steer people in the right direction. And so what I tell my patients is I have tried everything at one point or another in my career because I like to think I try to keep an open mind. I never want to be just so steadfast in the same stuff that I've done, for years that I am very closed off to new technology and innovation. So there are a lot of devices that are marketed to tighten skin. And I won't say specific names, but I will say that a lot of these more devices use either radio frequency energy or ultrasound energy. And I think if you Google either of those phrases, you'll be met with like a list of names.
Yeah.
What we have seen is that these devices may have a mild to moderate benefit for the skin. So for skin texture,
Yeah.
but they do not effectively tighten anything.
Yeah.
If anything, one risk to doing these devices, and this has been shown in newer studies, is that it can actually lead to facial fat loss, which is the last thing that we
Wow.
want when we're trying to rejuvenate a face. And this is kind of the ugly side of just new devices in general, where,
Yeah.
you know, a lot of the radio frequency devices hit the market, I want to say 2 to 3 years ago. Every time something new comes out, we all get excited about it. We start using it. However, there's a little bit of a lag before anything is published about, okay, what are the real world consequences of using these devices? So I personally stopped using them in my practice probably around 2022. I
Okay.
just didn't find that I was getting the results that they were promising. And I do try to be mindful about how much things are costing
Yeah.
because I meet people every week, Chrissy, where usually I start off consultations. I'll say, "Hi, how'd you hear about me? Okay, tell me everything you've done to your face." And so sometimes that part of the discussion is very short, and sometimes it just keeps going and going and going and going. And every now and then I just stop and I say, "How much do you think you've spent
Yeah.
doing all of this?" Because the
Right.
reality is, you buy sessions for these treatments, and the sessions are not like, I don't know, $100 a piece.
Oh,
They're a
no.
lot more than that.
Sure.
So I meet people all the time. They could have paid for two surgeries,
Yeah.
sometimes three. And obviously, they're here because they still haven't gotten to a goal that they envision for themselves. So, the devices I am very, at this point in my career, apprehensive about. I find that most of the time they are ineffective and disappointing. The bigger issue then becomes, as surgeons, we are now noticing that they do seem to have long term implications for the tissue underneath. And we are starting to see that because it is becoming increasingly rare for me to operate on somebody that hasn't tried this stuff because
Yeah.
it's so alluring and it's so tempting. Like, of course, I want to tighten my jowl with three
Right.
sessions that I can do at lunch with minimal downtime. The reality is it's not that easy. And so intraoperatively, a lot of surgeons and a lot of them have been pretty vocal about this online. Some have even received cease and desists from these device companies where we're experiencing more scar tissue. The
Yeah.
dissection is then harder because of the scar tissue. And when your dissection is more difficult, you increase the risk of the pre existing risks of just doing the surgery in the first place.
Sure.
So I always tell patients, my job is also to keep, you never want to, pun intended, cut off your nose to spite your face.
Right. Oh my gosh. Okay. So that's really interesting information to know because I don't think a lot of people know about that. And to your point, I do think a lot of people are willing to spend the money on, things that have minimal downtime and that they think are going to get results. So thank you for sharing all of that. I have a question about, I want to get into plastic surgery and the different types of facial plastic surgery that there are. Because I mean, I know there's a full facelift, you can do a mini facelift, you could do a lower facelift. Yeah, like I just want to understand a little bit about what all those terms mean. But my first question before we get into that is there an age range of women that you see where you think is like sort of the sweet spot to maybe get to start thinking about or actually get a facelift?
100%. 100%. I used to say it made no difference, but with time comes experience and with experience comes wisdom. I find, and the sweet spot can change a little bit from person
Yeah.
to person. In my experience, The sweet spot for the general public is about 50 to 60.
Okay.
Before the age of 50, and most people, and I also want to preface this by saying, I always take age with a grain of salt because
Right.
people age very differently. Everyone is shaped differently. Skin is different. So age is not the most important thing that matters to me. Your
Sure.
anatomy is. But I find that before the age of 50, patients typically don't have enough going on for the juice to be worth the squeeze. Like, I want the surgery to be worth it. I want the surgery to be worth your time. I want it to be worth your money. And I want it to be worth the recovery because, of course, there's a recovery involved. I'm not big into the like, I don't want to call it the preventative facelift, but like, if all you have is a little bit of jowling,
Yeah.
I like to say, like, give me more to do. Like, I
Right.
don't feel right taking you to the operating room if there's just like a little bit of this one thing. I want the juice to be worth the squeeze for you. And before the age of 50, and most people, there just isn't enough. And there's not enough to where I can't make it better. I'm not saying you have to do nothing
Right.
because I
Right.
think, I want people to feel good about how they look. But there are other things we can do, like a little bit of filler, a little bit of strategic Botox, kind of as a stepping stone until we get to that point. So
Right.
50 to 60 is the age range at which there is enough anatomically for me to address and for your before and after to be like, whoa. Like, I don't want to do a surgery where when I put the pictures together, I'm, an average person can't tell what happened. To me, that's a waste of time and money on
Sure.
everyone's part. Now, after the age of 60 or 65, there are some things that happen that I think negatively and adversely affect the results of the surgery. Number one is as we get older, we just become less resilient. We
Yeah.
don't recover as quickly. Our bodies are not as formidable almost. And I
Yeah.
always use kids as an example. So, my background's head and neck. I trained as an ENT. Once upon a time, I took out tonsils. You can take out the tonsils of a 4-year-old, and within a few days, they're jumping around. You can take out the tonsils of someone in their 20s or 30s, which I usually tried to talk them out of because of how painful the recovery is. And it's like you did a completely different surgery.
Right.
So we know as we get older, when it comes to certain things, it's harder to recover. The second thing is our tissue changes. So there are two things I can't help with surgery, and one of them is tissue quality or tissue integrity. I have to work with what you have. And as we get
Yeah.
older, we lose collagen, we lose elastin, and it doesn't matter how much I lift, there's always a degree of relaxation that happens afterwards because the skin stretches. We know this. Anyone that's been through a pregnancy knows this just based upon how your belly changes. And so I find that the older a patient is, the higher that degree of relaxation is, which then, of course, affects their final result. Is
Yeah.
it worlds better than it was before? Yes, of course. 99% of the time, it's way better than it was before. Is it as good as it could have been had they done it 5 to 7 years prior? No, no. The second thing that I can't change with surgery is someone's bone structure. And women, particularly Caucasian women, we all know we're at increased risk for osteoporosis. But when people say osteoporosis, I think you just think of like, your legs and your arms
Yeah.
and your
And
pelvis,
joints.
joints.
Yeah.
Yeah.
Joints. Yeah.
But the reality is, and we have CT scan studies that prove this, not only do you lose bone from your body, you actually lose bone from your face too. And so
Wow.
a lot of age related changes are not because, or not only because tissue's fallen, you've lost fat, but it's actually because your skeleton has changed in your face. And so if the underlying foundation isn't strong, like if you don't have much of a jawline anymore, it may also be because there's not as much bone there anymore. And like I said, we've got CT scans that prove this. So I find that there is a sweet spot, and the sweet spot is when your tissue quality is still good, your bone stock is still good, you're at a point where you can recover in pretty much 2 weeks or less. And then the fourth variable is something that is a little more nuanced and maybe a little more abstract. And that is, I think, in my opinion, it's almost more worthwhile to do when you can enjoy it more.
Right.
And I'm not saying, I've operated on plenty of people in their 70s, 80s. My oldest patient was in her early 90s.
Aw.
It's just, there's something to be said about liking how you look, feeling your best when you are still working, when you are still socially active,
Yeah.
when, your kids are maybe starting to get engaged and you've got weddings coming up. And I just find that those are your 50s and 60s, or that 10-year gap. There's a lot of important stuff that happens during that period.
Yeah.
And wouldn't it be nice to not cringe when you look in the mirror or when you see a photo of yourself?
Yeah, absolutely. Yeah, and I mean it helps with everything. It helps with your mindset. I mean how you feel looking in the mirror every day affects every aspect of your life, and how you approach those and how you think about yourself and emotional behavior and everything. So that makes a ton of sense. Okay, so let's talk a little bit about like full facelift versus a mini facelift or a half facelift, or I guess I've heard of lower facelift. I'm sitting here like pulling my skin. It looks so much better when I do that. What are sort of a little bit of the quick and dirty of all of these different
Hmm.
terms that are available, options that are available?
Totally. So, wait, that's a great question, Chrissy, because it touches on actually a huge problem in the facelift world, which is there is no standardized terminology for what these procedures mean.
Oh, wow. Okay.
Yeah, it's like a huge point of contention. It's very confusing for patients. It's confusing for me too sometimes. Facelift means different things to different surgeons. For some surgeons, a facelift is the cheeks, the jawline, and the neck.
Okay.
For me, a facelift is cheeks, jawline. I refer to the neck as a separate procedure. That is a neck lift.
Okay. That would make sense to me
Yeah,
because
and
it's your neck, not your face.
right. Ironically, I trained with a wonderful surgeon down in Florida. To him, a facelift was everything. So
Yeah.
this is something that we kind of decide for ourselves in terms of, okay, what language do I want to use when I talk about this? Now, what adds to the confusion is back in the day, back in the 80s and the 90s, when you said facelift, it would also encompass the upper face.
Yeah.
Most surgeons have gotten away from that because now we refer to this as a brow lift and an upper eyelid lift. That is almost, those are separate procedures now. And I think that change happened because not everyone who needs their cheeks lifted, their jawline sculpted, their neck tightened also needs their brows and eyelids done.
Okay.
So it was almost too broad of a term. Now, the best way to kind of cut through the noise as a patient is to ask, right? Like, okay, what do you mean when you say facelift? What are you lifting? And conversely, when I'm talking to patients in consultations, I usually say, don't worry about what it's called. Just tell me what you want lifted. If
Yeah.
the smile lines bother you, that's a facelift.
Yeah.
If just the pre-jowl or the what people call the marionette line bothers
Mm.
you could call that a lower facelift. I usually discourage patients from doing that because once this is tightened, the smile line is going to be all that you see. But it's important to really dissect out what that term means for that surgeon because there is no consensus, and that's actually a huge problem.
Yeah.
And then it actually gets even more complicated because you have surgeons who specifically brand their procedures. So they come up with an entirely different name for them. So I could be like, well, I do the Bayrak lift, when in reality, the Bayrak lift is probably just your normal facelift.
Right. But you
But
can say anything you want because there's no standardized terminology.
exactly, exactly.
And so, okay, so from, let's just say a facelift, cheeks, the jawline, marionette lines, just the facelift. And then we'll talk about the neck next. But what is the scarring like? Because I think that has come a long way too, from like, obviously procedures have changed over the years. But people are worried about what are people going to see scars? Are they going to know I got a facelift? What is the scarring from that kind of procedure, like a facelift?
So very, very reasonable cause for concern for patients, especially once, they come in and I start going over the incisions. The incision for a facelift is typically in front of the ear and behind the ear. And it's the in front of the ear portion that really kind of gives people a little bit of anxiety because women, especially, like, I want to be able to wear my hair up.
Sure.
And so I would say the biggest change that's happened from a technique perspective is that we are no longer, as surgeons, we are no longer relying on the skin to lift things. That is how people typically got bad scarring. Because if you put too much tension on the skin, you're going to end up with scars that are raised, scars that are wide, and that is unacceptable. What's interesting is that it actually probably, I'll have to have someone time this when I'm in the operating room. I feel like it probably takes me just as much time to close the incisions as it does to do the actual like facelift part.
Yeah.
But I would
Yeah.
argue it's just as important because that's what you see. So I could do
Right.
the most beautiful lift in the world. You could have the jawline of a 25-year-old, but if your scarring is horrendous, it's a completely unacceptable cosmetic result. So I would say the first thing that's changed is our technique. We no longer rely on skin to hold the tension of the lift. And that's where techniques like the deep plane lift,
Yeah.
which many have heard of, even if they don't know exactly what it means. Ultimately, what it means is you're actually suspending the muscle layer of the face, and that is doing your heavy lifting so that the skin is tensionless. And that's how you can get beautiful, beautiful scars. I tell patients scars are not bad, bad scars are bad. So anytime
Right.
you make an incision, you're going to get a scar. But I think it's why I actually have basically a photo library and I try to put healed incisions on Instagram constantly so people can see just how well this incision heals, especially with the technique that puts the tension on the underlying structures.
Okay. Yeah.
And then, of course, suture materials have changed. We've just gotten better on all fronts. So the scarring, while typically something that makes people very nervous, is, I mean, these scars heal beautifully. So
Yeah.
it's usually not a problem. And I also say, listen, I could make a 2 centimeter incision in the middle of your cheek. I could spend an hour closing it up to the best of my ability, and that would be more noticeable than your facelift scar.
Yeah. Yeah. Absolutely. And and a neck scar, where are those typically? Is that near the ears as well, or is that underneath?
hmm So the neck scar typically involves it's the behind the ear portion, but it
Okay.
also is a limb that it has a limb that comes down the hairline.
Oh,
And
okay. So
that
it's
allows
hidden.
me, yeah, yeah. And
It's
actually,
great.
if you make that incision a certain way, it's called beveling your incision. You actually get hair to grow back out through the scar because you're keeping the follicles underneath. So we have all sorts of little tips and tricks because ultimately, no one should know. No one
Yeah.
should know that you even know me. No one should know that you've ever even been to my office, right?
Yes.
That's a good result. And ultimately, no one should know. I find the biggest compliment for me is when patients come back and I'm like, okay, has anyone said anything? And they're
Yeah.
like, my coworker Julie, she was like, oh, did you change your hair or is your makeup different?
Yeah.
That's what we want.
Right.
That's
Absolutely.
the reaction. So
Yeah.
there's the behind the ear part, and the hairline part, but hair grows back out through that. And then there's actually a tiny incision under the chin that allows me to address the muscle in the neck. So
Okay.
all in all, incisions, not an issue.
Great. So, is there like a typical length of time that these procedures last for? Like, are they forever procedures? Are they 15, 20 years? Do you,
Hmm.
is there a typical amount of time or no?
Yeah. Typical. Everyone's a little bit different, but my goal is always to rewind the clock. I'd say at least 10 years. Now, I say these procedures, they press rewind. They don't press pause, right? So you
Right, right,
continue to
right.
age.
Exactly.
So, let's say, you had surgery today. You would probably look your best in the first few years, but is 5 years after going to look as good as 1 year after? No. Is 10 years after going to look as good
Right,
as 5 years after? No, because you've continued to age. However, let's say I could clone you, Chrissy. So I have two Chrissies now. And one Chrissy had I call it facial rejuvenation surgery. One Chrissy had facial rejuvenation surgery. The other Chrissy did not. And let's say we fast forward 25 years when obviously the Chrissy that had surgery, has continued to age.
right,
The version of you or the version of someone who has had facial rejuvenation surgery will always look more youthful than not having done it. So
right,
some of the benefit is permanent, meaning the extra skin we took off, that doesn't come back. The muscle that we tightened, that doesn't come back. We almost reset the starting point. So even
right,
even though you do age, you're never going to be back to where you were.
right.
So I like to say it's like semi aspects of the surgery are semi-permanent.
Yeah. Yeah, that makes total sense. Yeah, because like you said, you're not completely stopping the clock, but
Hmm.
putting a little pause on it and rejuvenating. I love that
Totally.
facial rejuvenation surgery.
Hmm. Yeah.
That's great. Okay. Any advice to people that are considering it? It's something in the back of their mind. They think that
Hmm.
maybe someday they might want to do it. What advice do you have for those to find the right amazing doctor like yourself to do it? Like you're in Westchester, Pennsylvania. You I'm sure service this whole tri-state area. What are and any tips that you have for someone who might be sitting down with a physician? Because this is a big deal. Like you said, this is high value real estate.
Hmm.
Any tips for questions maybe to ask the physician?
Definitely. That's a great question, Chrissy. You've clearly done this before.
No, I
So
haven't
the
done
first,
plastic surgery, but I've done podcasts.
yeah,
But, I think that's an important point. Just, being a nurse and being in medicine, being in pharma,
yes,
I think that we have to understand that we have to be our own advocates always, right? And
yeah,
just because someone has a doctor before their name doesn't always mean that they might be the right person for you. So I think it's, the best thing to ask the right questions, be your own advocate. And sometimes we just don't know the questions to ask. So you being on the other
totally.
side,
Absolutely, absolutely. I mean, I personally, much like you do, I'm sure, I know doctors where, they're huge. Like maybe they're big on Instagram or they're big on TikTok and they
Exactly.
have a facade of being very successful. And I'm like, maybe I would not go to that person. And at the same
Right.
time, I know
Exactly.
docs who do
Yep.
amazing work. And they just aren't as big of a deal as they should be. So I think the first thing is, and this can be done before you even schedule an appointment, is look them up. Are
Yeah.
they board certified? And then the second part to that question is, what are they board certified in? Are they board certified in general surgery? Are they
Right.
board certified in dermatology? Or are they board certified in plastic surgery, head and neck surgery, facial plastic surgery, or oculoplastic surgery? Like those are your core domains.
Okay.
So a little bit of research beforehand. will help you even figure out who to make a consultation appointment with. The second part is to look at their before and afters. And in my field, not everyone chooses to share their pictures, and that's completely fine. That is a very personal decision. I am forever indebted to my patients who do allow me to show others their pictures, because that is so important when it comes to figuring out, okay, is this person right for me? Because there is a style to everything.
Sure.
So, I mean, it's kind of a silly example. I got married last year. So I'm looking
Oh,
for a makeup
congrats.
artist. Thank you. I'm looking for a makeup artist, and I'm looking at Instagrams, and there, there are definite styles to how people like to do things. And
Absolutely.
so, do I like this person's afters? Because I can tell you, especially if I'm putting something on the internet, I like how that looks. Like, that gives
Sure.
you insight into what I think looks beautiful. And if you don't think it looks beautiful, I'm probably not the person for you.
Right.
So, before and afters are important.
That's a
And
great
then I
point.
think the third thing, and maybe the most important thing, is so I practice in an area. There are a fair number of facial plastic surgeons, and all of them are talented.
Yeah.
We can all probably do basically the same thing. The question then becomes, how does this person make me feel?
Yeah.
Or do I feel like they're listening to me, or are they mostly the one doing the talking? Do I like how they make sure that all my questions are answered? Do I feel comfortable in the presence of this person? Because I think what we forget, or at least some people, I don't let my patients forget this, but cosmetic surgery is still surgery. I take it very seriously. To me, it
Sure.
is, it is my open heart surgery, right?
Right.
And in some instances, I actually argue that, as someone who used to do trauma and do cancer reconstruction, it's easy to sign up for surgery when you have a problem.
Sure.
But I am taking people who are completely well. None of my patients need any of the things that I do,
Right.
but I am taking them and I am temporarily making them unwell in hopes that I make them look a little more refreshed and rejuvenated. The stakes are
Right.
very high. So surgery is still surgery. It's still very serious. And nothing in life is 100%, and that includes facial plastic surgery. So I always tell people, everyone has turbulence afterwards. Maybe it's like a part of the incision's a little red, you have a little swelling on one side that doesn't seem to be going away as fast as it should. There's always stuff that comes up afterwards,
Sure.
always. Very rarely do I have someone who just coasts through, because that's not, the bodies are unpredictable, healing is unpredictable. But do I think the person in front of me is going to be a source of support and comfort when those things happen? Or am I worried that they're going to be dismissive, ignore me, and minimize my concerns? Because ultimately, I mean, within 20 miles of me, there are easily, I don't know, three or four people that do a beautiful facelift. But
Right.
ultimately, it comes down to personality. Who do I vibe with? Who do I feel the most comfortable with? Because to me, once I operate on somebody, that's a forever relationship. That's a
Sure.
very intimate relationship. This is not a factory. This is not an assembly line of facelifts. There are
Right.
places like that, sure, but that's not how I like to do things. So ultimately, it's how a person makes you feel. And I meet people in consultations all the time where I'm their first consult. I make them, I strongly encourage them. I can't make anybody do anything. I strongly encourage them. I'm like, you know what? See somebody else, because
Yeah.
I want you to be sure about your decision and your faith in me. See somebody else. It's not like I'm trying to
Absolutely.
get rid of somebody, but I want you
Right.
to be sure. And I want you to be as committed to me as I am to you, should we move forward. So ultimately, that third piece of the puzzle is a little bit more of a feelings thing. But I think it's important.
Absolutely. It's very important. And like you said, it's, you're really establishing of relationship. This is something that is elective. It's not something that has to be done. And you're establishing a real relationship, and it should feel like that with your physician. Well, Dr. Bayrak, thank you so much for joining me today on the podcast. I know that I feel like I've learned so much. You have such a wonderful, comfortable, natural way about you. And I could see how you absolutely put your patients at ease and connect with them, on a daily basis. So thank you for explaining to us how we can all do what we can do to feel, rejuvenated. I think it's really important, as we discussed, for us all to be able to look in the mirror and wake up and love what we see in the mirror. We only get this one life, and we should be making the absolute most of it each and every day. So tell my listeners, where can they find you on Instagram or on socials, I should say?
Yeah, so I primarily put all my focus into Instagram, and my
Great.
handle is at dr, like the shortened version of doctor, dot Bayrak, Bayrak. I have a
Awesome.
TikTok. I'm not that active on it, but Instagram is kind of, that's where I put all my efforts. So, it's a little bit of me. It's a lot of before and afters. I answer questions, and so it's kind of the best way to contact me.
Awesome. Okay, that's great. Well, we will also put that in the show notes for people that want to click right on over to Dr. Bayrock's Instagram. Thank you again for joining us. I hope all of you enjoyed this episode as much as I did. And I'll be back next week with another amazing Suburban Warrior here to share her story and expertise with us. In the meantime, don't forget to follow, rate, and review the podcast. And I'll see you next week.